I'm at CRI Associates in Reno, Nevada, and it's a pleasure to welcome all of you to this Euretina Symposium, Improving on the Standard of Care in Neovascular AMD, Addressing the VEGF-C and D Pathways. This is a symposium sponsored by Opthea. Here are my disclosures. So this is the agenda for today. I will start with some introduction and objectives, followed by Dr. Adnan Tufail, who will talk about neovascular AMD, where are we today? Then Dr. Jamie Chung will talk about most recent and emerging treatments in neovascular AMD, followed by Dr. Nod Lowenstein, who will join us shortly, talking about sozinibercept, or OPT-302, an emerging therapy with the potential to raise the standard of care benchmark in visual outcomes for our patients. This will be followed by a panel discussion, questions, summary, and closing remarks by Anand, because I have to go catch a flight, the last flight of the day, to get home. So here are the objectives. Understand the role of VEGF-C and D in neovascular AMD. Over the last 20 years or so, we have targeted VEGF-A, and that has revolutionized the vision outcomes for our patients, but we have not made improvement since then in terms of visual acuity, and we'll like to learn what is the role of VEGF-C and VEGF-D in neovascular AMD to improve outcomes for our patients. Second section will establish the emerging therapies that are focused on reducing treatment burden. Every single program that's currently in development in mid or late stage is focusing on durability. So sozinibercept is the only molecule that is in late stage looking at superior visual outcomes for our patients. And then the last objective is to introduce sozinibercept as the only late stage emerging therapy for the potential to improve outcomes, as I said. It is such a pleasure to have top international speakers here today. Adnan Tufail doesn't require any introduction. He's from Moorfields Eye Hospital, and also University College London. And then Jamie Chang, again, no need an introduction either. She's from Duke NUS Medical School from Singapore. And Anand Lowenstein, the current president of Euretina, again, doesn't need an introduction. So let's get started with a case. So audience, please vote. So scan this QR code or go to the voting app, voting in the event app. So this is a very straightforward question. What is your initial treatment for this patient? The OCT is shown, and you see the visual acuity is 59 letters, and CST is 462 microns. The answers are bevacizumab, ranibizumab, aflibercept 2 milligram, aflibercept 8 milligram, or faricimab. And we're just trying to see how you start these patients currently on treatment. So while they're voting, Adnan, I will ask you, what is your standard of care currently in your practice and in UK?
So in the UK, we're very fortunate that all patients are eligible for any of the licensed anti-VEGFs on the NHS. And so we will follow what we think is right for the patient and what we think will give us the best treat and extend or the best visual acuity type recovery. And there's quite a lot of variability, but it's all the licensed therapies.
Great. And how about your practice? No, I was just in UK you said, but you didn't give me an answer.
Oh, so what my preferred one
Yes.
is going to be, so we've just got aflibercept HD and faricimab, but many of our patients doing really well on the current longer therapies who are happy we don't switch.
Okay, great. Thank you so much. Jamie?
Yeah, I think all of them are viable initial treatment, and really depends on the patient's own circumstances. If cost is an issue, then we go for A or B. But ideally, we'd like to have something that has a longer durability, so from C onwards.
So one of the second generation, newer, longer lasting agent, that's how you start. Sorry for that noise. So the voting is on. I don't know, or is it working in the app? Okay, great. Are we going to see the results here? You may have to. Here we go. Very, very interesting. But yeah, to Adnan and Jamie's point, we are lucky to have so many different agents available. And you see variability because the outcomes for our patients are same, regardless of any of the agents you use, because when you look at visual acuity, is comparable to ranibizumab or aflibercept. So I think I wanted to start this conversation that, yes, durability has been an unmet need over the last decade or so. I was surprised to see that now durability, based on ASRS PATH survey of this year, is not the #1 unmet need. It's actually better visual acuity. So I know you guys will dive into that, but I just wanted to get the audience thinking about how we can optimize outcomes for our patients so that we can give them the best quality of life, because we're in the business of giving them the best vision, and that's what they care about.